In this chapter, we want to teach you how to detect and distinguish the most common focal liver lesions. A thorough examination of the whole liver is required to be able to detect focal pathologies. But before we start with this chapter, I want to tell you a story I will never forget. I remember an episode at the beginning of my ultrasound career. I was still an apprentice for abdominal ultrasound, and I examined a female patient. It was just a routine checkup. At this time, of course, I was supervised after each examination of one of my experienced colleagues. I had completed my investigation, and in this case, our head physician was supervising me. I told him that I hadn't found any pathologies and that these were normal findings. Afterwards, he examined the patient himself, and he found a 3 centimeter big tumor at the tip of the left liver lobe. You can imagine how I felt in this situation. I was really ashamed and dissatisfied with myself. But you know, looking back now to the situation, I would say that these things just happen when we are still learning a new subject. And these are situations we will never forget. And in my case, of course, I was examining the liver especially careful afterwards. And you know, I was somehow rewarded. I really got an eye, especially for even small liver lesions. And somehow, I think this episode even intensified my dedication to learn and to improve my ultrasound skills. So remember, making mistakes when we are still learning can be really painful, but it is normal. Let's take these opportunities and profit from the situations instead of getting discouraged. Now, let's get on with our first focal liver pathology, a harmless one, the liver hemangioma. The liver hemangioma is a benign tumor composed of blood vessels that are atypical or irregular in arrangement and size. Its incidence varies from 2 to 7%, and it appears clearly more often in women. The pathophysiology is not really clear, but it is known that pregnancy and some pharmacologic agents like steroid or estrogen therapy can promote growth of liver hemangiomas. Clinically, liver hemangiomas are mostly asymptomatic. Usually, they are incidental findings. Very rarely, in large hemangiomas, they can produce pain, bleeding, and very seldom compression of bile ducts. Now let's take a look at hemangiomas of the liver in ultrasound. When you take a look at this picture of a right liver lobe over here, I'm sure you will detect this really wide area over here. It's hyperechoic, it's got a smooth border, and it looks like a snowball. This is a characteristic feature. Again, this picture over here in the middle of the right liver lobe, like you've thrown a snowball into the liver parenchyma. This is a video clip. And you can easily detect over here on the right side of a picture, again, a really hyperechoic white lesion like a snowball. It's got clear, smooth borders here in the left liver lobe. Another video clip for you. Now I give you some time to detect it yourself. Yes, you're right. Over here, again, a hyperechoic lesion, a typical liver hemangioma over here. Let's sum up the features of hemangiomas in ultrasound. Most of them are really like snowballs, round and hyperechoic. They can have a more oval shape and seldom can also be hypo or even isoechoic. In these cases, we need a contrast-enhanced method to exclude possible malign lesions. Hemangiomas have a smooth outline and frequently can show posterior acoustic enhancement. And remember one more thing. If you see one liver hemangioma in ultrasound, look out. There may be more of them. Our next pathology, liver cysts, are even more frequent than our hemangiomas. Liver cysts are benign liver lesions that contain serous fluid. They have clearly visible, thin, nearly imperceptible walls, and they are out of a cuboid epithelium. Usually, they show no symptoms at all. Only in very large cysts or polycystic liver, there can be symptoms like discomfort or even pain or bleeding into the cysts. Simple liver cysts are found in about 5% of the population. And here is the first example of a simple liver cyst. We can see here this round, echo-free structure with a very thin, clear border. And dorsal of the cyst, there is posterior acoustic enhancement. That means it is brighter because it's enhanced behind a structure which has got fluid in it. Now, I'll show you the video of it. It's in the left liver lobe over here. You can easily see this simple cyst, echo-free, clear, thin border, and the posterior acoustic enhancement over here. So in this case, I give you some time to detect the cyst yourself. You're right over here. Also a simple liver cyst, echo-free, thin and clear border, and posterior acoustic enhancement over here. But I want to show you something else, which is also a feature of liver cysts. It is the lateral shadowing. The lateral edge shadow is a very thin acoustic shadow that appears behind edges of cystic structures. You can see this on this side and on this side. Here we got the cyst, the posterior acoustic enhancement, and the lateral shadowing. Also in this video, here we got two liver cysts. The first one over here, and the second one over here. To distinguish a cyst from a vessel, we can just turn the transducer in the second plane. If it stays round, it's a cyst. But we can also use color Doppler.